Hi, welcome. My name is Maggie Johnson. I'm one of the mental health therapists here at Wooster Hospital, Behavioral Health, and this is the intensive outpatient program. Come on in. So our program consists of two tracks. One is what most people do. It's called the intensive outpatient program, or IOP. That's where people come anywhere between 2 to 4 days a week for 3 hours a day, and they stay about 6 to 8 weeks. And yes, that is a lot of therapy, but during that time you get group, you get individual sessions, you get medication management, and we see a lot of people get well pretty quickly. The other track is for patients who are experiencing even more significant symptoms. Either they're just left the inpatient hospital or they're getting to the point where they can't function and they're about to go there. That track's called the partial hospitalization. That program is 5 days a week for about 4 hours a day. The difference between PHP and IOP, aside from the amount of days patients come, is that instead of getting individual counseling weekly with IOP, in PHP they get counseling every day. Once patients are done with PHP, which is normally about 7 days, they transition down to IOP and they continue with the groups from there.
Hi there, I am the Behavioral Health Coordinator, so I will be the first point of contact whether you call or come in, and so I can give you a little bit of a description about our program, and then if you would like to, I will then set up the initial assessment.
If we walk a little bit this way, you're gonna see what we call the quote board or the inspiration board. Not only do we have an IOP program, but we also have an aftercare program for those who successfully graduate from IOP. Once those people graduate, they get to write a quote on the board as inspiration for others who are starting the program and probably feel pretty anxious about their treatment. We are going to enter the community room. So the community room is not only where patients come in every morning and get to hang out and meet, but it's where we run most of our groups.
Hi, I'm Rachel. I'm one of the mental health therapists here. So you might see me during the initial intake assessment, individual therapy, or running one of our many groups that we have here. These are just a few of the topics that we cover in the IOP program. One of the many things I like most about the IOP and PHP programs are seeing the support and encouragement clients coming from very different walks of life provide for each other.
Back here, we run our first group of the day. So I mentioned most of our groups are run out here. Rachel had over on the board the topics that we offer. The first group of the day is kind of just a process group. So let me show you the group room. So whenever I tell people what process group is like, I always say, think of therapy on TV. You're sitting in a circle. It's a great time to decompress, talk about what's stressing you out, but also what's a benefit or what positives you're seeing. A lot of patients find that first group helps them feel really connected to each other. Another component about our program that's really great is not only do you get a lot of group therapy, which is really helpful, but each patient gets connected with an individual therapist here. So I'm one of those therapists, Rachel is. Now let's go meet the other two.
Hi, I'm the clinical manager of the program, but I'm also a therapist here. And so you might see me for intake assessment. I also do individual counseling, and I run some of the groups here. The thing I love about working here is I think, many clients that come here, they've done numerous different kinds of therapies, and so they sometimes walk in here and they feel a little hopeless. And so I know group can sound really scary, but one thing I love about group is you're able to connect with other people that help you feel like you're not the only person that experiences this kind of symptoms. And so they start to gain a little bit of hope that, hey, maybe I can get better. And so getting to see people go from not functioning really well in at least one area of their life to being able to get back to functioning at work or back at home. And so I think that's one of the awesome things I get to experience here.
I'm the director here. I do some of the administrative stuff, but I also run a couple groups, and I primarily do a lot of the intake assessments. So if you're interested in coming in the program, the first person you see most likely will be me. We do about a 45-minute intake assessment just to figure out kind of what's going on, answer any questions you have, and then talk a little bit about what the program is. So that's my main role here. I've always just been fascinated with psychology in general. It's as a discipline, it's not just about diagnosing mental health illnesses or disorders. It's about finding processes and ways to increase people's well-being. And that's kind of what we do here every day. We find ways to increase people's well-being. And I think that's an important part of this job and probably one of the reasons I like it.
This is where you would see the nurse. Her name's Amber. primary role of Amber here would be helping with medication, checking vitals, going over history, and sometimes people need connected with primary care. And then Dr. Sharon DeLauro is our psychiatrist here. This is her office. She is here 1 day a week. She sees patients probably around like 45 minutes, and she does medication management for us, psych evaluations, and she's been with us, I want to say, for almost 5 years. Well, that's the tour of behavioral health. We hope that if you need our help, you come find us. We're excited to meet you.